Hi, I'm Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation, and we are back with 5 questions with ISHLT. I am here today with Sofya Tokman from the Norton Thoracic Institute. Good afternoon, Sofya.
Good afternoon. How are you?
I'm very well, thank you. Well, I want to dive into these questions with you today. Thanks for joining me, and I wanted to start with the basics. Will you tell us who you are, where you work, and what your role is with ISHLT?
Sure. My name is Sofya Tokman. I'm a transplant pulmonologist with Norton Thoracic Institute in Phoenix, Arizona. I've been here since July 2015 after having finished fellowship at UCSF. My role at Norton is largely clinical. I spend maybe 10 to 15% of my time doing some research. And my role at ISHLT has been that of many clinicians probably, that I am one of the co-authors on several consensus statements. I was fortunate enough to be included on the RAS consensus statement, and we're now working on the consensus statement for transplanting patients with connective tissue disorders. And I'm also a member of ISHLT, and I love attending the meetings.
Well, fantastic, and thanks for your collaboration with ISHLT. I know that these consensus statements are super important to clinicians around the world. What got you involved with the organization, and what's keeping you here?
I became involved with ISHLT as a fellow in about 2013, I want to say, and I thought that the conference was small and easier to navigate. It gave me a sense of community. It was also clinically very relevant. I thought the talks were excellent. And I joined ISHLT as a way to meet others in the transplant community and to learn about job opportunities, honestly, because I was thinking about sort of next steps after training. I've stayed at ISHLT because if nothing else, transplant keeps you humble. And having access to world experts on transplant who've been doing this for decades, that gives me a peace of mind that if I don't exactly know the direction I'm heading clinically, I can reach out to an expert and get an answer. And I have ISHLT to thank for that.
Well, it's fantastic that it's been such a great network for you, and all the way since fellowship. What inspired your career path? How did you get into doing, the pulmonology and the work that you're doing?
I was never a person who had a very clear direction in life. I stumbled on my career path, to be honest with you. So as a resident, I was interested in infectious disease. And after residency, I ended up doing a research fellowship with Dr. Lawrence Huang, who's a pulmonologist at UCSF who works at Ward 86. And Ward 86 is the AIDS ward. And so he and I did some research together on looking at lung disease in patients living with HIV. And I quickly realized that with better control of HIV-related immunosuppression, we weren't seeing the kind of opportunistic infections that people saw in the past. And once I started my pulmonary fellowship and did my transplant rotation, I realized that if you're interested in the overlap between infectious disease and pulmonary medicine, transplant is where it's at. And that's how I ended up in lung transplant, and I've never looked back.
That's awesome. And I can certainly relate to stumbling into a career path that you wind up being passionate about. So it's refreshing to hear that.
I was very lucky, very lucky.
There do seem to be a lot of stories in transplant with serendipity where people wind up here and then never look back.
Exactly. Yep.
What's a meaningful milestone, either in your career or in the field, that you'd like to share?
I think the COVID pandemic has changed the world and has changed our life, has changed the face of transplant in many ways. There are times at the height of the pandemic where we really had to slow down transplant. And we are now getting more and more patients that need lung transplant due to COVID infection. And so one of the milestones that our program achieved, and I've achieved, is transplanting patients with COVID-related respiratory failure. And I very distinctly remember us transplanting a young firefighter who was previously healthy, who was taken down by this virus, and now he's returned to relative normalcy after lung transplant. And that's been enormously rewarding and humbling and truly a milestone for me, for our program, and for transplant medicine in general, I think.
Absolutely, and really gives hope for people living with conditions, like his. So that's wonderful. Um, and in the same line, since we're all sort of grappling with the post-COVID, right? When you think about the future of your specialty, COVID or otherwise, what do you see on the horizon?
Well, I think as more and more people need lung transplant, and they may end up doing so as a result of this pandemic, the risk of people passing away waiting for lungs increases. And I think EVLP really offers a wonderful opportunity to expand access to donor organs. And I think that EVLP is the wave of the future, where we can not only shorten cold ischemic time, but also potentially rehabilitate organs that otherwise wouldn't have been transplantable and make them transplantable. And I hope that one day we'll reach a point where we won't have patients dying on the list.
Absolutely, that's the goal. So when you're not saving lives and figuring out how to keep people going, what do you do in your spare time? What's your idea of a perfect weekend?
It's honestly kind of boring, but after COVID, I think it's really the little things that I enjoy so much more. So honestly, a weekend with time to spend with my husband, with my dogs. Now get to see my friends since we're vaccinated. Have a drink or two. It's wonderful. I honestly relish that time in a way that I didn't before, and so I just like spending time with the people I love, and I value it so much more now.
Yeah, I would agree with that. That's one of the gifts of the pandemic. There are few, but that is one of them. Thank you so much for taking time to chat with me today. Is there anything else you wanted to reflect on for the ISHLT community that I didn't ask you about?
Well, I'm really excited for the conference. I look forward to the virtual forum. I think it'll be a unique experience for many of us, and it'll also allow people to attend the conference that otherwise wouldn't have been able to. So it's a great opportunity to increase attendance. And now that we're living in Zoom, here's yet another way where we can take advantage of this forum.
Absolutely. And after a year of not seeing each other, even seeing each other virtually is going to feel super great.
Agree.
Well, thanks so much for joining me. This has really been terrific, and I'm very excited to see, what you work on next.
Thank you so much, Jess. Have a great rest of your day.
You too.
Take care. Bye-bye.